Now, the second session is the Connected State, a new way to work in government, by Mr. Paul Long, Senior Vice President of Global Market Segment and Customer Program Unify.
There we are. Helps when you turn it on. So we've heard a lot about cloud. We've heard a lot about hybrid. We've heard a lot about security. So what I'm going to talk about is applying those principles and taking it into action in both the government sector and some other vertical industries. But first, about Unify. So we are 150 odd years young. We used to be part of Siemens. We're now an independent company. But we provide collaboration and communication products and services across the globe. We operate in about 60 countries. We have market share in the large and medium enterprise business as measured by a couple of the analyst firms. And we're ranked a market leader by the top analyst in the space. And in fact, 75% of the Fortune 500 use us in a number of our applications. So we actually do design a range of solutions that are very, very relevant in the government sector, backed up by a range of professional services. We provide mobile solutions, all forms of conferencing. Of course, as the foundation of all of this, we provide carrier-grade IP telephony. And we also take that further into a range of solutions that are designed for specific industries. At the foundation, and this has been a constant theme at the conference, our products have to be and are very secure to be able to compete for business on the global stage. We offer access and identity management verification. A good example of that would be the Metropolitan Police, the police service that serves London in the UK. We work on threat detection and migration procedures, and also, equally important, disaster recovery and crisis management. Disaster is going to hit at some stage. So it's not as much as preventing it, and then also how you recover from it. That's important in today's world. And our presenters are here who just followed me, had a different view on the world, but this is effectively the same slide, just in a different visual presentation. So we're offering highly scalable solutions. We're offering it as a cloud, and cloud breaks down into exactly the same modules of private, public cloud, or hybrid. And it can be virtualized in your data center or indeed ours with the technology of some of the panelists that are here today. As it relates to our verticals, we're focusing on 5 within the government and other areas. So public sector is our big government solution or set of solutions across federal or central government, state and local government, and there's an affiliation with education, and so we're placing education into that category. Healthcare, mainly on the provider, so the hospitals and the clinics, but we are now moving into the payer space. Financial services across a range of different subsections of that industry. Manufacturing with a heavy focus on automotive. And last but by not least, energy and utilities. Now, in each of these, not only do we have people in the marketing department, but we are developing products. We have deep field expertise all over the world. Both our applications and our content are very much vertical focus, where we are seeking to understand and prove that we can deliver solutions for the chosen verticals. As it relates to today, I'm going to focus on two of those. Firstly, government, and then healthcare. But I'll also give you some customer examples, both globally and locally, along the way. So let's start with the public sector service goals. Everybody's looking to balance their budgets. There's a consolidation going on, especially in the United States and the United Kingdom, where you have government institutions outsourcing or sharing among themselves, with one government department or one local government area actually providing services to others where they have either investment or expertise. Everything's about more productivity. So productivity from an employee perspective, productivity from an IT perspective. And then the way we're contacted by our citizens today, there was a presentation yesterday who the city of Boston said that they didn't want anybody going to City Hall. They want more digital government. And we need to find better ways of engaging citizens in the community so that we can serve them in a more responsive way, in a more effective way, and of course, in a secure way. A quote from the mayor of Los Angeles. Not a local quote, but Los Angeles is well known enough that, you know, and I'm not going to read the whole quote, but he's talking about proactively reaching out to citizens to engage with them. He's also giving them the tools to enable them to do business with you. And this is one of those situations of the anytime, anywhere, and in the way they want to do it. So another any flying there. However, this is all in the context of the reduced budgets. The services and the demands and the expectations are raised while the budgets are going down. Social media completely heightens the scrutiny that's going on within the organisation, be it a government or an enterprise organisation. And often the consequences of getting it wrong, especially in societies that are prone to do this, can result in a lot of fines, as well as the bad publicity that goes along with it. So in terms of engaging those citizens, there has to be some form of social media presence where it's permitted. There has to be rapid response to the crises, anticipating the needs, automating a lot of the solutions, and getting things right the first time. So what does it look like in terms of, this is probably one of my more technical slides, but not really, but it's all about solutions that are helping with those challenges. So unified communications and dealing with presence and availability, help solve employee productivity, citizen engagement via contact center applications. More and more people are mobile workers or remote workers, so give them a set of solutions that's going to enable them to do that. Security, of course, at the foundation, public safety, workflow and video surveillance. All of these are going to give you the ability to meet these challenges on this side of the slide here, in the reducing the costs and the emergency response and so on and so forth. What does it look like in a customer deployment scenario? Well, this is Baltimore County, which is on the eastern seaboard of the United States. Just outside of Baltimore. It's the complete area that surrounds Baltimore. And these people are providing emergency services response to the county of Baltimore. So as you can see, it's just over 2.5 million people in the area. They're taking over 700,000 calls a year across a variety of media. So in circumstances that are appropriate, emergency calls are coming in on text, because it may be a situation where making a phone call, reporting an attack, reporting a robbery, it may not be appropriate to use the phone. But the solution can really take those calls for the population. The population around Baltimore is rapidly growing, so this needs to scale. And I guess about 8 months ago, there were public riots in Baltimore due to some police action. And although this solution doesn't serve the city of Baltimore, it was able to step up and handle those calls on an overflow basis with a highly scalable, highly robust and secure solution. Second example would be the city of Stuttgart. And also, just going back, we also supply a similar solution on the previous slide to the Dubai police. On this slide, we are controlling the public network in the city of, for trains in the city of Stuttgart. And we're providing a easy-to-use user interface for the dispatchers, highly available and robust architecture, and over time it's proven to be a really low total cost of ownership. Again, a similar solution here in the area is being deployed, or has been deployed, in Riyadh. Final government example would be the Australian government, in this case a Department of Sustainability and the Environment. Australia has a huge geography of very disparate towns and cities, and what these folks wanted to do is connect all those cities to work as an integrated network. And so we're providing solutions across multiple locations, leveraging their existing requirement, deploying capabilities of instant messaging, collaboration across web and video, all the time, easy deployment, all the time, cost-effective and scalable deployment, and high reliability of keeping the project on time were absolute musts. And this is a great reference of a government deployment out there in Australia. So let's transition to healthcare. And you'll see that some of their goals are very similar to that of government, whereby they're looking to lower their costs. And in fact, we have done quite a few surveys in different parts of the world to validate this information. It's not my data, it's the healthcare providers' data that we're using to change our scenarios and change our products to ensure that they get what they need. They have a security area of patient records, so they want to be able to reduce their liability and not expose those, have a greater efficiency. In this case, it's getting people working more and more and more on medicine and less on the mundane tasks. And last, but by no means least, they are looking to take care of patients too. So there's a book I've just read by a medical doctor called Eric Tolles, and his book is called The Patient Will See You Now. And his book hypothesizes on the fact that the medical industry is one of the last to say that the customer is right, whereby the doctor is the all-knowing, all-seeing person. But who's a good judge of not the medical side of our symptoms, but how we feel, what we've done, did we do anything to get us there? And so his premise is we should start to listen to the patients more. So the doctor is still the person in charge. In a business sense, the doctor is still the CEO. But the patient should be used as a resource, similar to a COO, to report on everything that's going on with them. And perhaps my hypothesis is we should look to the hospitality industry. I arrived in country on Sunday, got the taxi from the airport to the hotel next door, and had a fantastic experience. And I work for Unify, not for Marriott, so there's the disclaimer. But when I got there, as soon as I'd landed, I'd checked in, so they pushed back a notification saying, "We're ready to wait for you." When I got there, I was greeted by name, having introduced myself. I was provided a range of in-room services. And I know that when I check out, they'll ask me how I want to check out, when I want to check out, do I want transportation back to the airport. And they'll also follow up with a post-stay survey to say, how did it go? And perhaps I would suggest that the medical industry could really take guidance from hospitality. If you have to go into hospital for some form of procedure, it can be stressful. You do want a range of in-room services unless you've been admitted in emergency. And all along the way, your experience could be a lot more pleasant if it took a cue from hospitality. This can be done in a variety of ways. One way is actually a product that we have in the portfolio, which is our healthcare station. So everything on there is the patient records done in a secure way. One of the certifications that was on the previous presenter slide was HIPAA, and this is HIPAA compliant for healthcare. Updates are real time. The physician or the nurse has the ability to log in to the device using RFID or some form of credentials. We can also educate the patient as to how they can update their own records, and we can also allow them indeed to go as far as ordering their own room meals for when they're in the hospital, which is the point of the reduced food waste. Also, there's the ability to then put collaboration tools on that device. So from a clinical perspective, across the clinical population, we'll know who's available. And so rather than me trying to make 3 phone calls and a cell phone call to get the information or find the x-ray physician or find the person dispensing the medicine, their presence would be displayed on either a mobile device or the actual bedside terminal. Connection would be instant. Point of care updates would be available, messaging flexibility, and as shown on the screen there, we can make it all mobile. Couple of examples in the healthcare space. Firstly is Penn Medicine, which is in just outside of Philadelphia in the United States. They're using that bedside terminal that we shown on a previous slide, and they've got 240 of them spread around the hospital. That's integrated into Siemens Healthcare Sorian application. It's integrated into document management, and it's also integrated into that dispensing of medicine to the various patients. So we have streamlined workflow in the rooms. This actually went from 20 terminals to 200 terminals in less than 6 months. Time savings for the staff for when they do the single sign-on. In this case, it's the RFID badge that recognizes them, gives them the credentials, so a very secure logon. It's enhancing the HIPAA, which is the patient records and the information compliance. And interestingly, because the patients are using the Terminal 2 to access their meals or see their own information, and they do the satisfaction on the exit from the hospital, their satisfaction scores, which is the HCAP scores there, are higher. Important for two things. On the HIPAA side, if they don't comply, they get fines, and it can be up to $10 million. And on the HCAP scores, very important, because unless they meet these scores, they get withdrawn, they get public funding withdrawn from them. So they're funded in the United States, partly by the insurance plans paying, but partly via the government funding, which is Medicare, Medicaid. If they don't hit these satisfaction scores, they do not get that funding. And so that cost will be passed on to somebody, and probably us, the patients. Second example is one of the largest hospitals in Finland, in Helsinki. These folks are, as a hospital itself, fairly large, over 6,000 doctors. You can read the quote yourselves, but it really is the whole portfolio, from the healthcare station through the unified communication and collaboration solutions that is being used in the Helsinki and Uusimaa hospital. The results speak for themselves. The healthcare stations have freed up the nurses and indeed the doctors to manage their tasks. This is about a 4-year-old, just over a 4-year-old implementation. So they're saving over 20% in 4 years, and that savings is expected to continue. They've empowered staff, patients, and got productivity savings, they estimate, at around 27%. And they've also implemented a contact center for proactive notification and also inbound inquiries from patients. And so they're growing as a hospital, they're attracting more patients to this particular hospital, and overall a great story of providing solutions in the marketplace. So hopefully I've taken a slightly different angle today by showing understanding of the market, portfolio that's available, and examples of where we've done it before, and shown, we can help reduce costs. We can provide that collaboration for productivity, staffing benefits, citizen benefits. The responsiveness is really improved, and leveraging secure solutions, scalable solutions. We think we have and we can continue to provide a new way to work in both public service and health. Thank you.